So good morning, everyone. My name is Shirley Paulson, and I am your technical host today. Thank you for joining us for our webinar, Disability Management and Return to Work. If you are having any trouble hearing, please click on the bottom left where you see the microphone. I'll just show you with my cursor. Click on the up arrow where you can select audio controls. Although your microphone is not enabled, you can ask questions at any time through the Q&A icon. Thank you to those of you who have pre-submitted your questions as well. Please use the comments section to chat with other attendees, provide your thoughts, and let us know where you are from. We will invite our panel to respond to as many questions as we can during today's session. Our moderator today is Lisa McGuire, founder and CEO of the Manufacturing Safety Alliance of BC. Lisa, welcome.
Thank you, Shirley, and thank you all for joining in today. Before I begin, I'd like to acknowledge that I'm speaking to you from the shared unceded territories of the Squamish and the Lil'wat Nations here in Whistler, British Columbia. For those who don't know us, the Manufacturing Safety Alliance of BC is the not-for-profit health and safety association serving manufacturers and food processors. Please call on us to answer your health and safety questions to help keep your workers safe. We also invite you to visit our website for safety training and resources, or to access our health and safety experts, as well as information on the Occupational Safety Standard of Excellence, core certification for manufacturing. We're here to learn about the important topic of disability management, return to work, and accommodation. Employers were quickly and successfully adapting their workplaces to attract and retain an underutilized demographic. Individuals with mental or physical impairments are ahead of others in reducing their job vacancy rate. With the new regulations now in effect under the BC Accessibility Act, all will be required to adapt their facilities to accommodate employers' physical or mental health impairments, with resource provisions included in the BC budget. In today's challenging labor environment, leveraging this support can help you tap into a broader talent market that isn't utilized or that is underutilized in our current workforce. This session includes information about the new regulation and how to adapt your workplace to accommodate employees with physical and mental impairments, as well as develop effective return to work programs. We've invited two distinguished guests to share their insights on disability management and return to work. This includes the availability of new programs to assist employers in developing inclusive workplaces to support a successful return to work, or to be an inviting place for people with physical or mental impairments to thrive. Beginning with yourself, Martin, as the Vice President of Innovation and Growth from TexMed Services, can you briefly introduce TexMed and the work your company does in the area of disability management and return to work? Welcome, Martin.
Thank you, Lisa. I really appreciate it. We're thrilled to be here. So a little bit about myself. So my name is Martin Paquette. I'm the Vice President of Innovation and Growth at TexMed. So we are a disability management firm. We've been in business for over 28 years here in Canada. We help many employers from across the country with occupational, non-occupational, and wellness initiatives. So our overall goal is to help employers and help their employees return to work and stay at work healthy and productive, and hopefully happy as well. And we are thrilled to be here. We work with employers of all shapes and sizes, from small mom and pop shops to large multi-provincial employers with 20 to 30,000 employees. So we're thrilled to be able to have a conversation about disability management and how important it is for employers in Canada.
Thank you, Martin. Very important work indeed. and Wolfgang as the Executive Director of the National Institute of Disability Management and Research, which is established here in BC. Can you please tell us about the work you and your institute offer? Welcome, Wolfgang.
Great. Thanks a lot, Lisa. Appreciate the opportunity and your initiative in moving this agenda forward. So, yeah, we're basically two hats. I look after the National Institute of Disability Management and Research, NIDMAR, as well as the Pacific Coast University for Workplace Health Sciences. So we are located here in Port Alberni, and we had NIDMAR initially started out as a joint effort between was created by a number of large companies led by Macmillan Bodell and the IWA and the Paper Workers Union in the early 90s, and then a whole number of other organizations out of the mining sector and so on, the unions that joined force. We basically started out by developing educational programming, professional certifications, and program standards. And the university is something that NIDMAR created. It's a statutory body. Our legislation came into effect on July 18th, 2007. We offer a degree program as well as continuing education programming, and we have about 1,800 students at this point, plus 50 faculty across the country and some around the world. So, and where we are today on the NIDMAR side is on the professional certification. Our standards have been adopted and are being used in 22 countries around the world, and we're trying to move the agenda forward. It's been challenging, but I hope we can contribute, and much appreciate your efforts and your organization in moving this forward. Thank you.
Thank you, Wolfgang, and what an evolution, and really nice to see it grow to fruition, around the world with interest. Thank you. BC is the 6th province to introduce the BC accessibility legislation, which came into force on September 1st, with all required to have a plan in place by next September 2023. With that comes funding from the government. Both our guests today will talk about the impact and what employers can expect when it comes to disability management and work. Martin, let's start with you. You're welcome to share your presentation to our audience, and you can begin sharing at your convenience. Thank you.
Thank you, Lisa. I appreciate it. I hope everybody can see my screen there. Fantastic. So first of all, we are thrilled to be here and to have this conversation. First, I'd like to acknowledge that we are honored to work on the traditional, ancestral, and unceded territory of the Chil'equyuk people. So to get started here, I want to talk about a little bit about our agenda, and I'm really passionate about disability management, so I'll do my best to speak slowly and clearly throughout this presentation. But if you have any questions, as Shirley was saying, as Lisa, please share them, of course. We'll be able to answer them throughout and at the end of the presentation. So first and foremost, I want to talk about a quick introduction to disability management. Then get into the roles and responsibilities of the employer. Now that's a long list. I might not be able to touch on all those points, but I want to focus on one specific important one. Then we're going to go over the common challenges that we've been hearing from Canadian employers and effective return to work programs as well. So we're going to end with solutions that you can implement, things that you can do today, essentially to help your business, help your organizations, and help your employees. There's one specific learning objective that I really want everybody to come out here is to really understand the importance of disability management and recognize how to improve those outcomes. So first and foremost, what is disability management? So in short, it's a coordinated and deliberate effort to facilitate the return to work of an ill or injured worker back to their full duties as soon as safely possible. So at the employer level, it's absolutely vital to tailor disability management program to an organization because each business is unique, from the culture to different organizational structure and the different strategies they may already have implemented. So what might lead to efficiencies for one company may actually result from confusion and frustrations for another. So the nature of disability management, the nature of businesses as a whole, can lead to different risk and different kinds of injuries or illnesses and different options for return to work. So some of the important elements to consider when it comes to disability management, of course, is the availability of modified duties, physical and cognitive demands, the work environment as a whole, medical assessments, the overall well-being of the worker, and of course, the legal obligations that are tied to that. So it's really important that organizations analyze and understand where the opportunities for improvement have when it comes to implementing a disability management program. Successful disability management strategies is crucial because, again, you can build with return to work plans, healthcare recommendations, and viable modified duties that always respect and abide by the ability of the employee. So always making sure that individual is cared for is extremely important because getting that cooperation is necessary as well. So navigating those nuances and the challenges that may complicate return to work is really, really important for an employer. So that's why being prepared and proactive is going to be an important part of our conversation here. So moving on to some of the important priorities and why an employer should care about disability management. Now, again, I'm passionate and maybe some may see me as biased, but the reality is, if you look at all the wonderful work that Wolfgang himself has done and with his team, it's amazing what we can achieve, really changing what employers do and making them realize and making everybody realize the importance of disability management for the greater good of everyone. So some of those aspects and why to prioritize it, of course, is to be able to support workers and provide them full wages. So the reality is that we're all humans. So being able to support individuals personally, but financially as well, so they can go out and support their families and live their lives is an important part and why I'm passionate about what we do. Because at the end of the day, no matter what we do, whatever we manufacture, whatever we work on, it's people to people, right? At the end of the day, it's someone that's going to buy or use your product or be inside of it, if it's a car or anything like that. So at the end of the day, it's so important that we treat each other with that respect and work together for when it comes to supporting workers. Another really important part, of course, is being able to reduce premiums. So that being workers' compensation premiums or insurance premiums, such as short-term disability or long-term disability. By being able to actually have an effective disability management program implemented, you will see an impact directly on your workers' compensation costs. You actually have control of reducing your workers' compensation. So just to give you a quick example of how much cost there is when it comes to the world of workers' compensation, on average in Canada, for every $1 that's paid towards claim costs for a claim on workers' compensation, that will translate usually for an employer at $3 in additional premiums. So that means that if you're paying an employee, say $20 an hour, that means that an employer, it's going to cost them $60 an hour if that employee is off work. Now you multiply that in a full day, that's $480. If you multiply that in a full week, that's $2,400 when an employee is off work. So again, that's a low wage I'm referring to, $20. It could be $50, then you multiply that by 3, that's significant wage cost when it comes to a claim. So it's so important that you actually control and have a disability management program in order to reduce those costs. Another important piece, of course, is to avoid needlessly having to cover staff. So losing a skilled worker has ripple effects when it comes to your business, of course, right? Also, additionally, there's going to be strains on other employees, coworkers, having to pay overtime. So essentially, it's very, very important that you have something in place in order to avoid having to pay those extra costs to cover for those skilled workers that are missing from disability if you don't have a good program in place. One of the most important things, of course, is the loss of productivity when it comes to businesses, right? We don't want to see businesses lose productivity. That's a negative impact when it comes to actual production, of course, but at the end of the day, it's going to have a ripple effect to costs and revenue. So it's so important right now. We're seeing that in 2014, it was estimated at $16.6 billion in costs in Canada on a yearly basis for disabilities. And now those numbers are looking closer to north of $20 billion. So of course, it's so important the impact it's causing to productivity in Canada when you don't have a good disability management program in place. And of course, there's legal obligations, and we'll talk a little bit about what that looks like as well. So what I want to kind of discuss with you as well is some of the roles and responsibilities, but I'll focus on one specific role and one specific responsibility, the duty to accommodate. So it's not only a legal obligation, but it's also a moral obligation, right? When it comes to not fulfilling your duty to accommodate as an employer, you put yourself at risk. You're exposing yourself to human rights complaint. That's a difficult issue to handle and can be a very costly one at that as well. Another important thing to consider is that a lot of people say, well, there's undue hardship, but we have to remember that undue hardship has a high threshold. So it's important to understand that at the end of the day, it's better to have a disability management program in place and being proactive rather than rely on having to prove undue hardship. So one of the challenges that we see with employers is really when it comes to potentially middle management, supervisors, that are making financial and legal decisions on behalf of an employer, and the employer might not be aware that that's happening. So let me give you an example. So if somebody is off work, for example, and because due to an injury at work, if they are looking to return to work, and let's say the medical is demonstrating that the limitations and restrictions would allow for modified duties, but a supervisor says, you know what, I don't want this individual to return. I'm choosing not to return. It's too much hassle. I have to make accommodations and I can't be bothered to do that. Well, right away, that decision that they're making can have some significant ramification. Not only is it wrong, ethically, morally, if you will, but it's also not the right approach when it comes to having to put yourself at risk for the financial hardship that will come from the person being off work, as I mentioned before, and also the legal ramification that may come if somebody says that they're not being accommodated and they're being discriminated against. So it's so incredibly important for leaders to understand what kind of responsibilities they're bestowing on their supervisors and managers when it comes to the duty to accommodate. So undue hardship, again, it's a high threshold. So for example, if the duty for an employer to accommodate comes with caveats where if there's too great of an undue hardship. For example, let me use an example where let's say there is a machinist working and that has developed a visual impairment. Well, if that risks their safety and the safety of others, of course, they can't do that specific job. But however, there could be other jobs within the organization that they can do, and there are some accommodations that can be done. So chances are there's something there. But if there isn't, then theoretically that might be proven as undue hardship. And just very quickly, when it comes to the duty to accommodate, just some important points to consider. So there's a few steps. We have some more information on our website if you want to see about what steps you need to take. First and foremost, by recognizing that there is a need for an accommodation, conducting a need assessments for that accommodation, making a decision on that accommodation, of course, and implementing that decision, following by a review of the accommodation, keeping records of all this throughout. So that's going to be a very important piece. And of course, if you want more information, we have some on our text talks on our website as well. So some more roles and responsibilities, and just due to time, I won't go through this exhaustive list. But of course, you have a role and responsibility to establish a disability management program, essentially by developing best practices and policies, build a list of suitable modified duties for a variety of different restrictions, communicate and promote and educate your program throughout the staff. And you have to train your leaders and managers and supervisors. One thing is the fact that you're joining this webinar today, you're joining this session is obviously a very good example that you're taking the right step in the right direction. That really shows that you're willing to actually put education at the forefront, prioritize it in your day-to-day, because I know everybody's busy. Something that's really important that I think people forget is that employers should not be afraid to ask for help. There are a lot of options out there. There's access to NINMAR certified auditors that can help you and assess your your disability management program. There's employer representatives such as ourselves and other representatives out there that can help you be an extension of your team and help you and point you in the right direction, right? And then of course, you can hire an INMAR certified experts as well. There are people that are taking the education with the team at INMAR in order to understand the importance and the nuances and the challenges when it comes to disability management. So that's another great option. So don't be afraid to ask. That's one of the most important things. So some of the common challenges that really delay return to work. During our last webinar that I joined with the team at MSABC here, I noticed there was a lot of questions around medical delays. So what we're seeing, of course, right now is with medical assessments and wait times, there's significant delays that are actually being caused with our public system, unfortunately. So right now, just to give you an example of what that looks like, this is information from the Fraser Institute. Specialist appointments and MRIs are constantly climbing year over year. Just right now in 2021, it takes approximately 10.2 weeks for an MRI and 11.1 weeks to wait for a specialist. So as you can appreciate, that causes significant delays in the person, not only their well-being, but their ability to return to work and be back to their full self. So those delays are causing frustration for a lot of employers. Another frustration I'm hearing from a lot of Canadian employers is vague medical information, indiscriminate time off. You know, you've heard it before, the prescription pad that says 2 weeks off. That causes a lot of frustration because, again, employers are feeling like the doctors are patient driven, that they are being asked. And I'll be honest, that's true. Personally, myself, I remember last time I went to see my doctor because I was feeling unwell. I had something bothering me for a couple of weeks. That was pre-COVID, of course. And I went to see my doctor. I said, something's bothering my throat. I just want to get it away so I can move on with my life. And he said to me, well, how much time do you want off? And I said, oh, I don't want any time off. I just want to make this better. Oh, okay. He went on and he asked me 3 times during my meeting, how much time do you want off? And every single time I said, I don't want any time off. I just want to get better. And I thought that was interesting because at the end of the day, he thought that that's why I was there. He thought I was there because I needed time off or I wanted time off, but that wasn't the reality. So patient-driven doctors definitely cause some frustration for a lot of employers. We'll talk about some ways to get around that. And then, of course, some of the frustrations we're hearing, as well as the time to get medical information back from the doctors. Again, that can be delayed. And of course, you can end up waiting a week. And then next thing you know, you got a prescription pad that says 2 weeks off. And then you're confused, you're frustrated, you don't know what's going on. So something I'm going to say, it's a little bit of a shocking statement, but I'll say it anyways, because every time I speak to employers, I've had numerous opportunities to do that and sit with some of our clients and talk to them. And I realize a pattern, and this is going to be a shocking statement for some of you, but at the end of the day, the doctor doesn't have the final say. There's so many people out there that rely solely and wholeheartedly on what the doctor says as being sort of the gospel, if you will. But there's a lot that has to be considered with that. At the end of the day, there has to be medical objective evidence tied to it that shows what the person's abilities are. So the functional restrictions and limitations are something that you as an employer have the right to receive so that you can then get to working on the accommodation. So at the end of the day, an employer is entitled for those specific functional limitations and functional abilities of an employee after a workplace incident. There needs to be objective medical evidence, of course, to support that. And the employee, they have the right to be informed of their options when it comes to choose to return. And that's why it's so important when there's an offer of modified duties involved, either in an occupational or non-occupational setting, that the employee understands that there is an option out there for them to return to work. So being proactive and having those options in place at the forefront, and then training your staff, supervisors, first aid attendants, and managers to be able to make those offers, that's going to make a huge difference when it comes to how you manage your disability management program and how you reduce your premiums when it comes to either WCB or SDE. So some of the solutions that you can implement when it comes to disability management and trying to deal proactively with some of the frustrations that comes with employers, it's going to be, a lot of it is going to be that proactive communication. There's a lot of stakeholders involved. There's, of course, the worker themselves, There's going to be you as an employer, maybe an employer representative is involved as well. You'll have the insurance company, either being the workers' compensation board or being anybody who is involved when it comes to the healthcare practitioner, case managers. There's a lot of people. So the most important thing is to being proactive with your employees to make them understand that if they are injured at work, there is a program in place. There's the disability management program. There's information being constantly shared with your team through education, through training, so that they are aware of what happens and what to expect if they are injured at work, if they're injured outside of work, if they're unable to do their work, if they're suffering from mental health issues, anything at all. Sharing that information proactively has demonstrated time and time again as a great solution for employers to implement that and actually be able to get ahead of the problem. I've actually, unfortunately, been part of conversations when employers first start with us, and they say, well, we don't want to put up posters. We don't want to send out emails. We don't want to tell everybody because we feel that if we tell everybody what you do when you get injured or what happens when you get injured outside of work, or if you're not feeling well, that's going to increase the number of requests to be off work. That's going to cause more problems. That's going to bring and shine light to it. And every time I tell them that's not the case. It's been proven time and time again, right? The percentage of people that want to take advantage of the system are very small. They are there, they do exist, and we deal with those on our end all the time. But it's such a small percentage. You have to build your disability management program to support the employees that are legitimately hurt, that need help to recover at work, stay at work, and that's a really important part. So you have to get ahead of it and proactively communicate and build a positive culture around that. So that positive culture is going to make a very big impact to how you deal day to day with a disability. So essentially that culture of a win-win approach where an employee knows that they can return to work, get their full salary, be able to contribute, and then be able to actually move forward with their actual financial decisions that they're making at home as well. And then, of course, being able to make an offer, an immediate offer of modified duties based on common sense restrictions. That's an important part of how you're going to be able to convey to the employee and thus their doctor as well, that there is an opportunity for return to work, that there are modified duties, either sanitary or light in nature, that would allow somebody to return to work. Lisa, how am I doing on time?
I think you are slightly over time, Martin, but really excellent information. I mean, is there a wrap up or how much time do you have? I
got 1 minute. I'll wrap up very quickly. I'm very passionate about this. So thank you so much.
Thank you.
So just to also focus on some more solutions, one of the most important thing, again, is open, collaborative, and regular communication with all stakeholders, right? Having the board aware is one thing, but having the employee talk. The reality is a lot of employees want to return to work and are able to return to work in some capacity. Have those conversations directly with the employee. If you have an employer representative, have them have those conversations on your behalf. So there's that constant communication happening. If you feel that it's a legitimate time loss, then do protest or appeal illegitimate time loss. That's an important piece of your rights and what you're able to do. And then be creative with the production of modified duties. One of the things I hear all the time is they say, oh, we don't have modified duties before even an injury occurred. So get ahead of it, be proactive, think about cross-training and different opportunities that there are there. So all of this, of course, includes different solutions when it comes to detailed medical assessments and forms that you can send. If you have your own forms, fantastic. If you don't, we can support you with that. And so can the MSABC, having early access to physio, medical diagnostic. And then if you have to, I know this sounds crazy, but you can challenge uncooperative physicians. They don't have the final say. And because of that, you have those rights to do that. So overall, one of the exciting things, and this is my transition over to my friend Wolfgang, is there are other solutions. The National Institute of Disability Management Research, NIDMAR, has things like scholarship opportunities, free continuing education, as well as free workplace assessments. So some really, really great solutions. Don't be afraid to ask for help. So let me pass it back to you, Lisa.
Thank you, Martin. A wealth of information, and I really do love your passion for this topic. You know, a couple of key points: importance of tailoring your disability management to individuals and the modified tasks attached to them. being prepared to adapt. I mean, that's our new normal for everything. So it's really, really important. The reasons for prioritizing disability management for your business, the important legal obligation and duty to accommodate, and of course, roles and responsibilities for the employer under disability management. And you're not alone. There is external support there. And an excellent segue to move forward with you, Wolfgang. Really looking forward to your perspective. Can you provide us, to begin, some of how you got started in the disability management field?
Great. Yeah, thanks a lot, Lisa, for that, and Martin for, I think, an excellent presentation of where the solutions are. So in my case, literally, I got started in this business by accident, and so I guess at risk of dating myself, some 45 years ago, working for McMillan Bedell, first week on the job. Here's a power saw, good luck, go for it. And the tree ended up coming down on me and broke my back. And so that's basically what happened. It was a logging camp outside of Port Alberni. We had about 450 guys working there. And we had a fatality on average every 18 months, and that was more or less accepted in terms of the forest industry. We had close to 10 across the company, but in this particular camp. So what really was key for me, and this kind of builds on all of the solutions that Martin identified in his presentation. What it really comes down to is the attitude of the workplace. So in my case, because it was the first week on the job, the company did accept responsibility, and obviously McMillan Bedell was the biggest employer in the province, biggest forest company in the country. And the union pushed, and the logging camp was about as inaccessible as you can imagine, the administration building. And I was fortunate that I had initially graduated in civil and forest engineering and was looking at getting back. And the commitment on the part of the union, the IWA, and now, of course, the steelworkers and the company says, yes, we're going to make that happen. And so it took the engineering crew about 3 hours to figure out how to basically look at designing access to the administration building. And then it took the camp carpentry crew and machine crew about a week or so, built the ramps, widened the doorways, and made the washroom accessible and all the rest of it. So what this really means is, and I've said this many times, it comes down to the attitude in the workplace. And you will know this with because the same principles apply to health and safety. You can have all of the best solutions. Somebody needs to be willing to avail themselves of the solutions, the options, and the type of positive practices that are out there. Because if you don't do that, the best solutions aren't going to help. And so in this case, it comes down to leadership and attitude. That's the absolute key. If it hadn't been for the fact that there was this commitment by the part of the HR manager at the time and the union camp chair at the time, the fact that the building was completely inaccessible would have always been the excuse. Well, the building is inaccessible, we can't bring you back to work. But once that was changed to saying, yes, we're going to figure out a solution, and with today's knowledge that we have in the disability management field from around the world, there are solutions for, I'm not going to say for every situation, because some of them are extremely challenging, but for most. But the key is to have the right attitude to say, we want to make a difference, and to provide that leadership that will allow you to make a difference. So that's kind of how I got involved in this, and then basically carried on in terms of, becoming an accountant, hated every minute of it, but worked in that role for McMillan Bedell, and then went into corporate HR at MMB, and was lucky to make the transition to Weyerhaeuser when Weyerhaeuser bought MMB. And then we rolled out our disability management program right across the country. and basically retired from the organization 34 years later. So that's kind of what happened. But the key is the attitude of the workplace and the leadership that can be provided at every level to make a difference.
What an incredible story, Wolfgang. Thank you for sharing it with us. You know, your passion and what you've achieved, you should be extremely proud. It's a lot. Absolutely, you know, leadership and attitude of enabling, you know, a successful return, you know, are important contributors. And there's a lot of work still yet to do in this area, but I'm happy that we're on the right path. Absolutely. In just looking at the data, because you've prepared a presentation that all of the attendees here have today, there's a lot of data included in that. Can you share some of what is most interesting and impactful from that data to the audience?
And part of the challenge that we always run into is that individuals and organizations, but organizations are made up of individuals. We don't understand the scale of disability, the fact that 80% of all impairments happen during mental and physical health impairments happen during somebody's working life. So it's not, you know, the vast majority of individuals. It's not something that, you know, you start out with these things. These things just happen, and the workplace is the absolute key to that. And the part that I think, and as to why you are seeing such emphasis on looking at regulatory changes, is that that we have 1.4 million Canadians with disabilities that live in poverty, and the vast majority got to that point because they acquired some type of an impairment. You know, the ratio is about 70-30. 30% on average of all mental and physical health impairments are occupationally based, but 70% are on the non-occupational side. So whether it's cancer, whether it's car accidents, sporting injuries, you name it, 70% are on the non-occupational side. So that's you know, so that's fairly significant. And the employment component, of course, has been recognized that, you know, by government at all levels. The fact that if you are no longer gainfully employed and you are part of this, you know, part of the system, there's a huge personal price to be paid, and most individuals don't recognize the impact because it's not something we want to think about. You know, we don't go to work with the expectation that something is going to happen to you in terms of, my case, an accident, you know, or that one day you end up with a bad diagnosis. I mean, we're especially seeing that now with the impact of long COVID. You know, we are still, the average numbers seem to indicate that that's about 30% of all COVID cases will have a long COVID component to them. In speaking with the WCB CEOs across the country, that is a huge concern for them from a financial impact point of view, because if for one reason or another, the result of long COVID, individuals don't go back to work, don't have the ability to go back to work, then obviously what happens to them, it's a concern on the provincial level, certainly here in BC, because you've got an individual with suffering from long COVID. It's not an accepted claim. It's not part that's recognized, or they don't have long-term disability insurance. Then where do they go? They go into our provincial system. We have 130,000 people with disabilities on social assistance in our province, and the net present value of that liability is about 42 billion as we speak. And the outflow rate, and then I'll shut up, the outflow rate from the system is between 0.65 to 0.85% per year. People either, once they're on the system, individuals either, you know, retired age 65, whatever that means, or they pass away, which is why there's, you know, a huge huge potential impact. The other part of what's being recognized and what's leading to this whole focus, and as to why we also, got the financial support to make available what Martin referenced and you in terms of educational support through the university, as well as professional certification, is really an established 1+1 rule. And that means that if an individual is on disability support for 1 year, there's a 1% or less chance that that individual will ever work again. And based on data, because the focus is tremendous by the Ontario WCB on return to work, the tipping point starts at 6 months. So in a major way. So those are, I think, some of the key parts. The other element that, of course, you're well aware of is that, fatality rates have stayed stubbornly high over the last decade across Canada and around the world. And the number of permanent disabilities for every fatality is around 25. That's part that we don't see individuals disappear. And so really accommodating somebody who acquires an impairment is a win-win from an economic perspective, but also from a social perspective, because we see so much, certainly in this province, and I think right across the country, about addiction, suicides, and mental health, and a whole lot of that is attributed to poverty, chronic pain, and so on.
A lot of information, a lot of challenging statistics to hear, but we have a ways to go in moving forward. And part of what I think we need to really consider, which I'd like to ask next, is, it talks about how do we help qualify people in organizations to help build effective disability programs, and where do you start, right? This is all about enabling, and this webinar, wants to make sure that we do that. Can you talk a little bit about that and NIDMOR's role in that?
Yeah, I mean, perhaps I'll flip this over in terms of where to start, because it's a conversation that, interestingly enough, 14 years ago, I was part of the Ministers' Council for Persons with Disabilities, and we had a very interesting and progressive minister on this file, Claude Richmond, and at that time, and we looked at the whole area of, yes, we know at that time, at the end of 2007, we had 70,000 people with disabilities on social assistance. There's really only two ways on how to affect this. One is to keep individuals gainfully employed, and while they still have attachment to the workforce, so that they don't enter the system. And in order to address that, what we did, when I say we, during my time when I worked for Weyerhaeuser and was working for our Human Resources Vice President, we looked at implementing a disability management program. And what we did with Weyerhaeuser's support, McMillan Waddell's support, the unions, WCBs, we created an assessment protocol, which is similar to, you're familiar with that, of course, on the health and safety side, that you need a detailed gap analysis first, in terms of knowing where are we today and what is it that we need to do in terms of a roadmap going forward to become a best practice employer in this space. So we basically, with support of Labor Canada, spent about $2 million, and we had developed in the early 2000s an assessment protocol that gives you a gap analysis that is evidence-based and a roadmap going forward. And that is what we launched with the provincial government in 2008. The reason I'm referencing it is simply because coming out of that is the entire enhanced disability management program in BC's healthcare sector that maybe maybe some in your audience may be familiar with, but essentially all the global best practices in disability management are enshrined into the collective agreement that covers all 200 plus employers in BC's healthcare sector, all of the health authorities, all of the long-term and community care facilities, and across all 4 unions, BCNU, HSA, HEU, and BCGU, about 150,000. So that would be, I think, a recommendation that builds on what Martin also said, is that the provincial government in 2008 made this a standard for business in BC. We're quite pleased at that time, and it was repeated and recognized last year in launching this, and that would be the very first step. No different than if you're looking at introducing a financial management system or assessing where your financial management system is right now, by saying, okay, we need to get a detailed gap analysis of what do we have in place today, and what is the roadmap that we need to go forward in building a best practice program. And as part of that, we can certainly support that, because they are, I think, as Martin referenced, certified auditors. It's a very, it's a well-established process, and there are a number of countries around the world that use the same assessment program. It's essentially an ISO standard.
Excellent. No, I mean, a really great place to start. Looking at a gap analysis makes a lot of sense. Where are you to a good standard, and where can you improve, being kind of prioritizing that. So absolutely excellent place to begin. Really looking at some of the questions from the audience, knowing that we are moving very quickly into the time frame. The first question that I'm seeing: what can an employer do for employees who are on WCB but are not cooperating with providing medical limitation, doctor's notes, or work with TextMed with recovery? Can you talk a little bit about what would be the suggested solution? Maybe starting with yourself, Martin.
Yeah, I mean, we hear that all the time. There's that aspects of uncooperativeness. And of course, if an employee is not being cooperative, even directly with the Workers' Compensation Board, there's the ramification on their claim and the acceptance of their claim on that end. That's what you got to get in front of it, really, right? Having already put in place a win-win approach with your employees and that culture around that, to be able to actually speak with them and collaborate with them. Like for us as a third party, we sometimes get that opportunity to do that because we're not the employer. We work directly with the employees. So we sometimes have different conversations that an employee would be willing to have with their manager, right? So again, having a cooperative approach to say, look, this is what we're looking to help you with. We want you to get better. We want you to get financially stable as well. So get your full pay, not just a portion of your pay. We want to help you and try to encourage it from that standpoint. Otherwise, I mean, you always have the Workers' Compensation Board that you can rely on as well in a work-related injury or an insurer to leverage as well. But at the end of the day, it's being ahead of it, getting that cooperation, because you have that expectation of return to work around as a culture in front of it, so that you get cooperation from the forefront.
So just added to that, Martin, how do you work with maybe physicians or doctors that are not cooperating, in terms of providing information? Do you have any solutions on that particular challenge?
Yeah. So that's what we see all the time, the frustration of getting that prescription pad with written, just scribbled 2 weeks off, and it's very unclear. So the most important thing, of course, is to reach out to the healthcare practitioner and essentially provide them detailed forms that you want them to complete that would actually complete functional restrictions and limitations, but still protect the medical confidentiality of the individual. So again, reaching out to the doctor is okay. You're allowed to do that as an employer. You have the right to do that. And then having detailed forms and requesting them to complete those forms in order to obtain the medical the restrictions and limitations. That's how you deal with that.
Okay. And those that are on maybe extremely light duties from a graduated return to work, you talked a little bit about in your presentation, who should pay this amount. Should it be WorkSafe BC paying the worker hours, or allowing WorkSafe BC or the employer?
Always the employer. It's always better financially for an employer to have somebody return to work if it's sanitary or light duties every single time. If not, you will pay a lot more in the workers' compensation costs, or your STD premiums will go up. So it's always great to support, especially in the workers' compensation world, to support a return to work, even if it's sedentary or light duties.
Okay, thank you. And Wolfgang, how do you think the culture will change to shape our workplaces with effective, inclusive policies, and most importantly, sustained behaviors? You talked about leadership and the importance of leadership in that. Can you talk about that? How do we do that? How do we establish that culture?
I think if we look at if we look at models and examples sort of from around the world, I mean, they're really we actually just finished a really interesting research project that dealt with this, and there are essentially three key elements that will over time change culture. One is through the regulatory process, which shapes initially behavior, and over time will change the culture. The second one is the economic part. That is well established, and Martin talked about that, and there's tremendous evidence in terms of the economic impact, and the International Social Security Association that you're familiar with out of Geneva had commissioned the German workers' compensation system to do a major international research study in this regard. And the third part is institutional leadership. And to that extent, I recall that we had an individual by the name of Bob Findlay as the chief executive of McMillan-Waddell, and we could never ever get on his radar, and it was just not a priority. And MMB was at maximum demerit on the WCB side because of the number of fatalities. I mean, we had at Kelsey Bay 3 fatalities in 10 months in a 1,260 worker logging camp, and then a fellow by the name of Tom Stevens became the CEO. And as Sid Fadadad, the CFO at the WCB, said, it was like turning an oil tanker on a dime. Within 18 months, MMB had gone from maximum demerit into a merit situation. It was individual leadership by saying, I will not, it was quite amazing. He says, I will not tolerate any senior vice president who is not able to operate their business in a safe way. So those are the 3 pieces that over time shape culture. One is the regulatory component, the economic component, and individual leadership.
Wow, and that's really good. Excellent. You need both, and you need a successful, and you also need a successful strategy to ensure that you're on the right path along the way in making those decisions. Martin, your thoughts on that? How do you see the role of leaders in shaping strategy and guiding change to address sustainable and positive change in disability management? You work with a number of employers.
Yeah, absolutely. I'm saying that's one of the most important things is like people that are joining us today are most likely in a leadership position. Their role are crucial, very important. Everybody's role is important in order to kind of convey that culture and communicate proactively that there is a program in place, that you have something in the shape of a disability management program, even if you have something very small to start with, and build upon that, and get collaboration, get your joint health and safety committees involved, reach out for help as well. But show that you are educating yourself first, and show that you're promoting education within your team, and spread that communication proactively through education and supportive nature of modified duties in that work environment. That's how you do it. You have to lead. 100% agree with Wolfgang. You have to have that leadership, kind of move that forward through education, training, and support.
So applying that to an example, if you have an individual that continues to perhaps be on WorkSafe BC disability, how do you approach that? Can you give any solutions if you have some people that seem to be getting injured more than others?
Right. Yeah. Some people refer to them as like frequent flyers, right? They have a little membership card, and but yeah. So I think the most important thing really for them is understanding, their general wellness as well. Sometimes, there might be something sort of at first the assumption is nefarious at hand, right? But communicate directly, openly, and transparently with that individual. Have a conversation with them. Job satisfaction comes into play. They might have personal problems, which, you know, let's say they're not sleeping well because they got a baby infant. They get to work and they're not prioritizing safety because they're nodding off at work, right? Have conversations with them to understand that these aren't humans, these are individuals. What is it that's happening in their lives that's affecting them? So then you get a bigger picture. You know, job satisfaction, wellness outside of work, all those things can play into factors as to, and then of course, if you have to, then reprimand if you need to, in a sense of safety, to make sure that they understand that they have the safety education, but if they're deliberately not being safe, then document that, and through, you know, again, discipline action if you need to, right? If they are truly just neglectful when it comes to safety. So those are all different tricks depending on each individual case.
Absolutely. Thank you. All great tips as we close the door here. We're getting close to the hour. Any final thoughts or remarks from either of you? Maybe Wolfgang, any final thoughts, and then Martin, and then we'll wrap up.
Yeah, I think the part that I would like to simply stress is again, coming back to leadership, and by way of example, and some of the audience may know this individual. Her name is Ida Goodrow. She was the chief executive of Vancouver Coastal Health in 2008. And she was beyond frustrated that their costs were going way up. The fact that a whole number of nurses were on long-term disability and were not being looked after. And while at the same time, they were desperately struggling to find new nurses, something we are finding today. And she took the bull by the horn, and as I mentioned earlier, started out with an assessment because she said, we have a problem in our system. It's pretty obvious by the stats, and I want to find out where it is. And with her leadership, it then rippled through the entire healthcare system in terms of long-term substantive change. And that really comes down to, leadership at the top to change attitudes, because I think as Martin said, we have the solutions. Somebody needs to say, we're going to make this happen.
Absolutely. And Martin, just last a couple thoughts, 10, 15 seconds.
Yeah, education, fantastic. But really at the end of the day, don't be afraid to ask for help. There are so many resources. I mean, Ninmar has tons of great resources. MSABC, fantastic. Third-party employers, right? Just ask for help. We have experts out there. You guys are your own experts in your own manufacturing fields, whatever you do. Ask for help. There's experts out there that can help and support you.
Well, thank you both. We're going to have to stop here. A wonderful panel that we're really privileged to have with us today. To everyone in the audience, thank you for participating. If we didn't get to your question, we'll do our best to respond in a follow-up. Additional resources will be available on our website tomorrow. Please visit our media library anytime for on-demand content, news, and resources, and event information. We'll be emailing all of you a link to the recorded webinar and related resources. And if you haven't already, please register online for our next webinar, Managing Your WorkSafe BC Costs, with moderator and Safety Alliance Chief Operating Officer Wayne Arondis. He'll be with you next week. And also, please book your spots for our Make It Safe 2022 conference. You'll have the opportunity to learn more about what's next for leadership. Early bird rates were supposed to end today, but we're extending these. So please watch for the announcement. Would love to see you there. Thank you all for attending here today. Please check your inbox for a survey link to share your feedback and suggestions to help us improve future webinars. Have a wonderful rest of day. Take care.